Hello, everybody. I'm Sarah Downey, the President and CEO of the Michael Garron Hospital, and welcome to our community edition of Five Questions, a program we've launched during COVID to bring you updates and the advice of Michael Garron experts on what is going on in our community with respect to COVID-19. And it's my pleasure today to have one of Michael Garron's specialists, a geriatrician, Dr. Jared Rosenberg, with me today. The focus of our session today is in seniors who live in East Toronto. And as a geriatrician, Dr. Rosenberg has a lot of expertise in treating our older adults, but lately has been spending a lot of time with seniors outside Michael Garron in long-term care homes and retirement residents, etc. So it's my pleasure to have Dr. Rosenberg with me today. So let me start by saying, Dr. Rosenberg, what is a geriatrician and what's your usual job at Michael Garron Hospital?
Well, thanks so much for having me, Sarah. I am a geriatrician here at Michael Garron Hospital, and I attend or take care of patients who are admitted to our acute care for elders unit here, which is a unit in the hospital that specializes on interprofessional function-focused care that's delivered by a wonderful team of nurses, allied healthcare professionals, and myself. And I also do consults for patients that are admitted to any of the services here at Michael Garron Hospital to help prevent complications and optimize their geriatric care over the course of their hospitalization.
Great. So there's been a lot of talk in the media about the challenges for people with COVID-19 in the older population, and in particular in long-term care facilities. What are the biggest challenges facing long-term care homes in this pandemic? And what makes these facilities in the seniors population particularly vulnerable to this disease?
You know, seniors, unfortunately, and specifically those older adults over the age of 80 with other medical conditions are most vulnerable to severe disease or death related to COVID. Unfortunately, this virus is really adversely affecting our most vulnerable, and seniors anywhere in the community and elsewhere are certainly at risk, but those seniors that live in more congregate environments, retirement homes, even seniors building, and particularly those who live in long-term care homes across our city are at highest risk. And this is for a number of reasons. One is that a lot of residents of long-term care facilities have dementia, and patients with dementia tend to have sometimes responsive behaviors such as wandering, that can promote the spread of infectious diseases. And furthermore, this is their home. And so a lot of long-term care facilities implement programs like recreational programming, social programming, communal dining, which is important for brain health. It's important for socialization. But unfortunately, this does tend to worsen the spread of something like COVID-19. And we have seen that, unfortunately, across the province. The other challenge, of course, is that hospitals are very well equipped with expertise and resources to implement infection prevention and control measures. And as I outlined with some of the challenges with patients with dementia or other older adults, you could argue that in the long-term care setting, implementing some of these best practices to identify and prevent the spread of infectious disease is even greater in the long-term care setting. But unfortunately, long-term care homes are not resourced the same way acute care hospitals are. And as such, many of them have a lot of difficulty implementing infection prevention and control measures and receiving timely advice or guidance around the barriers that they encounter when trying.
Great. So I know you've led teams that have gone out and partnered with long-term care facilities to make their environments safer. Can you speak a bit about the expertise and the types of teams you would bring out with you into long-term care to help make the situation for seniors a little safer?
Yeah, so I think interdisciplinary partnership is the key piece. And I think that, so as I mentioned, infection prevention and control is definitely something that a lot of the long-term care facilities that we've worked with have identified as a need that we've been able to help with. So in some cases, we do daily check-ins or check-ins several times a week to identify infection prevention and control questions or issues. And in other cases, we've actually done on-site visits with an interprofessional team. So that's included a physician, an infection prevention and control specialist or manager, even environmental service worker, to provide a lens of things in the environment that we can optimize and strategies we can implement to make sure that both staff in long-term care facilities and residents are safe. We've also been able to link with, in addition to geriatrics expertise, infectious disease expertise, palliative care expertise, especially in the setting of COVID, to make sure that the needs of residents of long-term care are met to help prevent the infection, and for those that unfortunately do have COVID-19, to make sure that their care needs are met.
Great. And I think another group of doctors you worked a lot with are some of the family doctors in East Toronto. Do you want to speak a bit about some of the family doctors you've reached out to and been working with in this?
Absolutely. So I would say that the East Toronto Family Practice Network has been a critical component of our outreach to seniors, both in the long-term care setting, in retirement home setting, and those in the community. In terms of engaging the family physicians who are usually the primary care providers for residents of long-term care, we have set up a weekly meeting where we meet with all of the physicians and we discuss their concerns, challenges they're encountering, and develop mitigation strategies. And our Toronto Family Practice Network, East Toronto Family Practice Network, has helped facilitated those meetings and those discussions. And in the retirement home setting and for other congregate living environments, our family physician team has really been instrumental in developing, hearing the needs of our residents and responding in a timely way. For example, we identified that COVID swabs were very, very delayed in the retirement home setting, and this was leading to, unfortunately, excessive use of PPE and also a delay in the terms of time to diagnosis. And as our family physician group came together to be able to provide mobile swabbing and process them through our own COVID assessment center, so that a diagnosis is usually provided within 48 hours, even less sometimes. And have also worked with specialists in our hospital to provide 7-day-a-week access to internal medicine consultation, palliative care consultation through the SCOPE program, which has been expanded also now to include long-term care physicians, as well as a need that was identified was expedited diagnostic imaging without going through the emergency department. And our emergency department team has worked closely with family physicians to develop a pretty remarkable pathway in a very short period of time to get expedited diagnostic imaging for seniors in the community or retirement homes.
Great. So it sounds like you're really bringing a lot of hospital expertise out to long-term care homes to be able to help in the diagnosis and management of the environment of the patients with COVID. But as you find patients with COVID-19 in long-term care homes, where in the end is the best place for their care?
You know, this is a tough question. And I think when we started our outreach to our long-term care partners, and for most of the facilities, this was in the prevention stages. And fortunately, we've actually been able to prevent outbreaks at most of the homes that we're involved with. We identified that this was a really important question. I'm not sure what the right answer is, and I really think it's changes and it's different based on what the values of a specific resident and their family are. But we did provide information, including videos, as well as a PDF to all residents and their families and family physicians in the long-term care setting, so that they could understand, unfortunately, in the context of COVID, this not being a curative illness, what the options were and what aligned best with what was important to them and what their wishes were. And so I think for a lot of seniors who live in the long-term care setting, it's their home. It's a treatment, it's a treating team with nurses and PSWs and other staff that know these patients, know their families. And in the context of there being limited visitation, both in hospital and in long-term care, often these teams are able to mobilize a much more involved care pathway for families and be able to provide supportive care in the comfort of that resident's home. For other residents who feel that acute care hospital can provide a different type of care that better aligns with what their wishes are, then perhaps hospital might be a better option. I think we found that for most patients and their families, once they are provided with information about COVID and the different supportive care options, a lot have chosen to be cared for in the comfort of their long-term care facility. But I think a key component of that is being able to ensure that there are adequate resources in terms of staff, in terms of medications, in terms of other components of care to be sure that anyone who is cared for with COVID in their nursing home, that they will have all the care that they need.
Thanks. So my final question is, clearly there's a number of outbreaks in long-term care facilities across Ontario and into Quebec. How can we collectively flatten the curve for COVID in long-term care homes?
I think that's a very good question. I think the most important thing is that by every one of us engaging in social distancing is helping to flatten the curve and is going to be instrumental in helping those who are most vulnerable to COVID-19. And of course, that's our seniors in the community, in congregate living, and in long-term care facilities. But I think what we've discovered that is across the province and accordingly in the Toronto-East area, there are significant staff shortages in long-term care facilities. This includes nurses, personal support workers, environmental service workers, all of whom are critical in providing care for residents of long-term care and preventing spread of COVID. And so I would say that I think to our nurses, to our community members, I would encourage you to reach out to your MPP and advocate for our older adults, who many of whom can't advocate for themselves, to come up with strategies to urgently address these staff shortages, to make sure that our older adults who live in the long-term care setting receive the care and the support that they deserve.
Thank you, Dr. Rosenberg. You're an incredible advocate for seniors. You do a great job every day in our hospital, and our community is really lucky to have someone like you spending his time outside, helping our entire community be well through this really difficult period. And to everybody in our hospital and outside our hospital, we're really thinking we're starting to flatten this curve. So please remember, stay home if you don't need to go out, social distance, wear cloth masks when you do need to go out, and let's continue to work together to defeat COVID-19. With that, thanks everyone, and we'll talk again soon.
Thanks.